Good morning. So my name is Eric Root. I am the co-founder and CEO of Kellyn Foundation. And Kellyn Foundation and St. Luke's are the proud sponsors and the originators and partners in this wonderful event. We have other sponsors, ShopRite, that provided all the food for us. We're very thankful for that. And this beautiful facility was also donated. We have a contest at the end of this who can pronounce Lantricent. But Lantricent Retreat and Wellness Center is also one of our major sponsors. One of the things that we wanted to express today about lifestyle medicine, you're going to hit some fabulous speakers, great education, you're going to eat wonderful plant-based food, and you're going to get your steps in if you haven't noticed already. Every time you want food, you're going up and down those steps. Okay? So, I would like to introduce my co-founder, my partner, and one of the major driving forces of this initiative in the Lehigh Valley, and now beginning to be nationally also. Dr. Meagan Grega, co-founder, Chief Medical Officer of Kellyn Foundation. She is a summa cum laude from Bucknell in biochem and cell biology. She is an MD from the University of Pennsylvania. She was Lieutenant Commander of the United States Navy. She is, I'm adding this into your thing, she is also a martial arts black belt. She has been a staff physician at Huntington Medical, a director of women's health at Lafayette, managing director of this place, Lantricent, and which is the home of Kellyn Foundation. This is our home. And she frequently lectures on lifestyle medicine in colleges, universities, grand rounds, medical residency programs, and community forums. She mentors residents, medical dietitians, and nursing students are one of her passions. She's a member of the True Health Initiative Council of Directors and serves as a member of the several national task force groups in lifestyle medicine. She's a member of the American Academy of Family Practice, the American College of Lifestyle Medicine, and is board certified in both family medicine and lifestyle medicine. And I think I'm done talking about my partner, so I'm going to let her come up and razzle-dazzle you for guys for a while.
Thank you. So first, I just want to say how happy I am to see all of you guys here, and I am so excited that we're having this lifestyle medicine conference. And I also want to just say that, like Eric and Dr. Bonnie Coyle, who's right over here, and I have been dreaming and scheming about putting a conference like this together for about 10 years. So to be able to see all of your smiling faces out there is awesome. Now, to me, I sound like I have feed, like it isn't very clear. Can you guys hear me? All the way in the back, you guys are good? All right, cool, awesome. So, I'm kind of the person kicking off talking about why is lifestyle medicine important and why do we want to learn more about this. So, the title of my talk is Discontent is the First Necessity of Progress. That's a quote from Thomas Edison. But I would like to explain to you why I became very discontented, both as a physician and also just as a member of the general society. And hopefully, by the time we're done, all of you will be very discontented too. And I don't mean like in an angry, morose kind of a way, but more in a like, we could be doing so much better kind of a way. So let's talk about discontent here. Now, Winston Churchill said that healthy citizens are the greatest asset any country can have. And I want you to think about that as we go through all the statistics that I'm about to tell you today. These are the objectives of my talk, but they are also on your handout, so please take a look at them, and I have no financial disclosures to let you know about. So, in order to talk about my discontent, we have to go back to 1985, okay? This is me in 1985. And for any of you that lived through the 80s, you can totally see the Cyndi Lauper influence on my outfit here, right? And for any of you who are Eastern Area School District grads or people from the area, this is what we looked like going to the Prince and Princess dance in 9th grade back in Eastern Area School District. So this is 1985. How did our country look in 1985? So these are maps from the CDC that look at adult obesity rates. And back in 1985, you can look here, that through the entire country, no state had an obesity rate of 15%. Everybody was less than 15%. Okay, so that's 1985. Now this is 1995. Now I'm in medical school, and we're seeing a change in the colors across the country. Now this dark blue color is states that have an adult obesity rate, not overweight, obesity, of between 15 and 19%. Okay, let's go 10 more years forward, 2005. Now I'm a practicing family physician. I am seeing the devastating effects of these chronic diseases like diabetes and hypertension and heart disease, cancer, in my practice every day. And now we actually have states that have an adult obesity rate of greater than 30% here in 2005. And then we hit 2010, where no state in the entire country has an obesity rate as low as we had in every state back in 1985. So this is only 25 years that made that change. And this is where we are in 2017. I know the colors changed because the CDC decided to change how they did their reporting, but to make it easy, it's all worse, all of it. so that's the best way to put it. So what I would like to say is, what happened? This is me, but look what happened over the course of those, almost 30 years. And I would submit to you that if these maps that I was showing you, if this was showing the spread of some infectious disease, or like some sort of cancer, I think that the whole society would be up in arms. Like all you docs out there, remember H1N1 flu and how we all like poured all the money into research and vaccines and everything? But this is obesity. It's happened over the course of my adult lifetime, and there's barely an outcry about it. And for all of our silence in the face of this rising epidemic, it is still drastically affecting our health and our longevity. So here's the top 10 things that kill us in the United States. Oh, I'm sorry. No, it's not. These. It is not. These are the actual metrics here in the Lehigh Valley. So this is how we're doing as far as our health here in the Lehigh Valley. Our obesity rate is about 29%. Our adult diabetes rate is 11%. So I would like you to hold on to that number in your brain because we're going to talk about where we think we're headed as a country. But I also want you to know that that 11% is higher than the national average. So here in the Lehigh Valley, we are not even at the national average, and the national average isn't doing very well either. Physical inactivity, which means absolutely zero leisure time activity, like you do not get up and do basically anything other than your day-to-day work. 25% of us here in the Lehigh Valley would say zero physical activity, and we're not getting enough sleep either. And so that's probably not surprising. In Pennsylvania as a whole, about a third of us have high blood pressure, a third of us have high cholesterol, and 1 out of 20 of us have already had our first heart attack. So cardiovascular disease is the most likely thing to kill any of us. And if we were the typical American population sitting here in this room, it would be the most likely thing to kill all of them, well, at least half of us here in this room. And over 800,000 people are dying annually from this. So I just want you to think about it. During our 24 hours of the Lifestyle Medicine Symposium day, well over 2,000 people will die of cardiovascular disease. And it's a completely preventable and usually reversible disease. It's a foodborne illness. So we have over 2,000 people a day dying from a foodborne illness. If that was cholera, I think we would be doing something about it, right? Now, unfortunately, diabetes is not far behind as far as causing death and disability. So 30 million Americans currently have diabetes. We think another 84 million have insulin resistance or pre-diabetes. And here we go, teaching to the test. CDC predicts that 2 out of 5 Americans will develop type 2 diabetes in their lifetime. So that's 40%. So we're at 11% now. think of how much money we are spending and how much disability and loss of life we're seeing now. If we are at 11% now, and by 2050 we are 40%, think of what that's going to do to our healthcare system. Now, the economic implications are also staggering. When you look at the fact that we're spending $316 billion a year for cardiovascular disease, $146 billion for obesity, $245 billion for diabetes, like it gets almost mind-numbing when you hear all of that. But think about what we could be spending that money on if we were not spending it treating chronic disease and all too often just treating the symptoms, not really reversing it, just trying to kind of cover up what's going on. So the Federal Congressional Budget Office predicts that Medicare and Medicaid will account for 20% of GDP by 2050. That's just Medicare and Medicaid. That's not all the other healthcare costs. This will bankrupt our system. So this gives you another idea of the economic implications. These are meds that diabetics are commonly on, but I want you to especially see this one right here. That's Lantus. In 2015, we spent as a country $11.1 billion on Lantus alone. And this is definitely something that we can get our patients off of with intensive lifestyle therapy changes. So, we always like to be number one in the USA, right? We're always like, USA, we're number one. And we are, in money that we spend on healthcare. So, this is us. We're the black line compared to everybody, other high-income countries. So what are we getting for our money, right? Like maybe we're getting something good. We spend more than everybody else. What do we get for it? Well, here's male life expectancy. And as you can see, we're dead last. Here's female life expectancy. Again, dead last compared to other high-income countries that have similar societies as ours. And when you look at death by all causes, again, dead last. So we are spending more money than anybody else. And these are our health outcomes. So as a physician that practices in this country, this makes me go, what? Right? This is inconceivable. How is this possible? What is going wrong? So there has to be a better way. Here's the top 10 causes of things that kill us. There we go. So, at any rate, out of those top 10, 8 are things that are lifestyle related that we could impact. And so it's things like this that have me start digging into the literature and trying to figure out where is there a path to a better way? Like what societies are doing this better? Where do people live the longest? Is there any way that we can reverse this? And this is what took me to lifestyle medicine. So, there we go. So lifestyle medicine focuses on 6 pillars. It focuses on your food, it focuses on your sleep, your exercise, your stress reduction, social supportive connections, and avoidance of risky substances. So this is actually from the American College of Lifestyle Medicine saying that we can make such a difference with our patients if we've used evidence-based, and that's key, definitely evidence-based, lifestyle medicine approaches with a predominantly whole food, plant-based diet. We're not going to use the V word and say that it has to be vegan, but predominantly whole food, which you guys will be eating all through the day today, that we get enough physical activity, adequate sleep, stress management, and with all of those 6 pillars that we talked about, we can prevent. But what I think as a doctor, even more important for what we already have going on here, we can reverse a lot of our lifestyle-related diseases. So I'd like to introduce you quickly to just a couple other innovative, discontented, disruptor-type people. And then the rest of our presenters will be going into more detail about the way lifestyle medicine works and what sort of results you can expect. So this is Dr. Caldwell Esselstyn. And he is like an iconic person in the lifestyle medicine movement. He's now in his 80s, and the last time I saw him, he was biking around the hills of North Carolina with his son Rip on no medication. So this guy can definitely teach us a lot about what type of medicine we want to practice, but also what type of life that we want to live. And so he decided, when he was back at the Cleveland Clinic, he knew that there were all these heart disease patients that had gotten to the point where they were called the walking dead because they had already had their cabbages, they had already had their stents, And there really was not anything more that the expert cardiologist at Cleveland Clinic could do for them. And so Dr. Esselstyn said, let's try a plant-based diet approach. Now, this was a self-selected, non-randomized group, so think about that from the data standpoint, but the results are stunning. They did 5-hour counseling sessions in plant-based nutrition, and the patients were considered adherent if they got rid of meat, fish, eggs, dairy, and oils. And really the emphasis was on eating vegetables, green, leafy vegetables, lots of different colors, and that was really where they focused. And after 3.7 years, I think this is important because a lot of times people say, nobody's going to stick to this diet. Nobody's going to want to do this for the long term. But Dr. Esselstyn showed that after 3.7 years, 89% were still adherent to this diet. So it can be done. We have to talk a little bit about therapeutic dose and how do you make that work, but it can be done. And in a different cohort, he had 77% that were still adherent to the diet after 12 years. So, what happened? Now, Dr. Esselstyn doesn't focus much on stress reduction and exercise and things like that. He says, food. Look at your food. So here's some of his results. This is a PET scan here, which is showing blood flow to the heart muscle. Okay? This was the before, kind of losing some blood flow in that dark area. This is the after being on plant-based nutrition. Look at how the blood flow all filled back in. That's not with a stent, it's not with a cabbage. And, again, the most amazing part, that to that, 3 weeks. 3 weeks. Right? Now, is this not what we want for ourselves? And people say, well, how in the world in 3 weeks? How could you do that? Like, you can't dissolve a plaque, a big old cholesterol thing in your artery in 3 weeks? True, you cannot. However, you can help repair your endothelium, that lining of the blood vessels that does the nitric oxide and helps it vasodilate. So these are quick results. If you can get people on the program, you can go from this and angina, sorts of difficulty walking, to this. Now this over here is an artery, one of the coronary arteries, and this does show that it takes a little bit longer to open up. But this was a patient who decided not to get a coronary artery bypass graft or a stent, and after 32 months of plant-based diet, that's that same artery, right? That was not a bypass. That was food. So we can do that for our patients if we can help them adopt this type of lifestyle. Not only was that just food, that was not a statin, because it was before statins had even started. So our bodies have the capacity to heal if we just give them the right inputs to be able to do that. And really this is one of the things I think is amazing, that we should have known this for a long time. So those who cannot learn from history are doomed to repeat it. And I think we are repeating it day after day after day in our clinics, unfortunately. What Dr. Esselstyn knew, and what I found out looking into what lifestyle medicine was, there's been experiments like this for a long time. This was a natural experiment that nobody really wanted to have happen, but this was during World War II in Norway, and Norway was eating a pretty much normal, I would call Western diet, and this is their heart disease incidence, right? Oh, then they got invaded by the Nazis, right? Nazis took all their livestock, got rid of, all their dairy was gone, their eggs were gone, and they really had to go to, the Norwegians really had to go to eating a pretty simple diet of food that they could grow on their farms. Look what happened to their heart disease deaths. And we know this is not because the Nazis are great at public health. It's they were not trying to keep the Norwegians alive. But the Norwegians had to change their diet, and as such, they changed their heart disease rates. All right? And then we get VE Day, heart disease goes back up. Because the Norwegians had their cheese and their meat, and they went back to their normal Western lifestyle. This was reported in 1951, but yet it's not something I was taught in medical school. And I'm sure that a lot of you, whatever your health training, have probably not seen this unless you're into the lifestyle medicine movement. So we know that this can happen in a natural, outside of the world population, and yet here we are in 2019, and this is the sort of stuff we see, right? So a cardiologist says, you have two choices. You can perform a triple bypass surgery where you take a vein out of your thigh and then we put it across your chest and it's going to lay you up for 2 months and it's going to cost $100,000. Or we could get you to put you on a vegan diet. And the guy sitting here goes, a vegan diet? Doc, isn't that a little extreme? And it is funny, except like those of us who have seen people coming right out of bypass surgery, that's extreme. That is what's extreme. And so that brings me to one of my other favorite disruptors, which is Dr. Michael Clapper, who would say, welcome to camp, stop hitting yourself, right? It's the food, and it's always been the food. And if we are going to live, all of us or our patients, if we are going to live the standard American diet, or sorry, the standard American lifestyle, it should be no surprise to us that we die of the standard American diseases. That's just how it's going to go. So we need to kind of wake up and pay attention and not just kind of go along with the status quo, because the status quo takes us to heart disease, cancer, and diabetes. Okay, so here's another one of my favorite disruptors, Dr. Dean Ornish, and he did a whole lot of work with heart disease, just like Dr. Esselstyn did, found the same sort of results, able to reverse blockages and angina with just a plant-based diet, and Dr. Ornish also focuses on eating well, so that's the plant-based diet, moving more, so exercise, stressing less, doing stress management, and loving more, so that's the supportive relationships. So he did the same thing with heart disease, but then he said, you know what, why don't we see about cancer? Let's look at that. So he looked at prostate cancer. Now this is actually a randomized trial, which we like in medicine, right? And he took 93 men who had prostate cancer, and they said, we want to forego traditional therapy. We don't want the prostatectomy right now. We don't want the radiation right now. We want to do kind of the watchful waiting thing right now. And Dr. Warner said, okay, well, we're going to put half of you guys on this intensive lifestyle change program. The other half of you guys just watch, see what happens. And over 1 year, it was stunning that in the lifestyle change, so people who were eating well, moving more, stressing less, loving more, 0 needed to go to conventional treatment because of progression. And they had an average PSA decrease of 4%. But then their control group, 6 needed to go on to conventional treatment, and there was an average increase in PSA of 6%. So what we are doing is changing the course, the expression of the cancer in our bodies. And so he said, okay, let's take these prostate cancer cells, put them in cell culture, and then take the serum of the people that are doing the blood serum, the people that are doing the intensive therapy, lifestyle therapy change, and see what happens. They inhibited the cancer growth, their serum inhibited the cancer growth 8 times more than the people that weren't on the lifestyle change program. So their serum was killing cancer cells. That's what we want. We want our bodies going around and finding all the different cancer cells that are sort of popping up and killing them off. Lifestyle changes will do that. And so Dean Ornish was like, well, that's kind of interesting. I wonder why that happened. Maybe it's something going on with genetics and epigenetics. Why don't we look at that? And so he took 30 people with prostate cancer, did the same lifestyle therapy modifications, and after 3 months, he said, okay, let's look at gene expression. So these people acted as their own controls. They did a pre-intervention biopsy, they did a post-intervention biopsy, and after just 3 months, they found that 48 genes were upregulated, and that 453 were downregulated. So our lifestyle choices are directly affecting the expression of our genes. Like we often think that genetics are our destiny and that, unfortunately, whatever happened to our parents is going to happen to us. But that's not true. We can change it based on the lifestyle choices that we are making. And this, I think, is awesome. So then he looked at blood nuclear cells and looked at telomerase activity. So your telomeres are the ends of your chromosomes, kind of like your shoelace caps, that kind of, as you go through cell division, keeps your cells without having mutations. So really, we often say that you are only as old as your telomeres. So like you want to have long telomeres. Telomerase is what rebuilds the telomeres on the end of your chromosomes. And he found that in just 3 months, there was a significant increase in telomerase activity for these patients who had cancer. So they're like rebuilding themselves from the inside out, just based on their lifestyle. Okay. Here is another of my favorite innovative disruptors, who's somebody who really, really put his career on the line and said, okay, the status quo is not okay. I want to look at cancer rates and in protein, especially animal-based protein, and a whole bunch of other things. So this is T. Collin Campbell, and this is the China study, which is a huge study. It's a collaboration between Cornell, Oxford, and the Chinese Academy of Preventive Medicine. Looked at 65 different counties through rural China. And they did things there that we cannot even imagine trying to do to Americans. So this was a great study to do over there. But they hung out with them for days. They took blood and urine samples. They looked at their food. And what they were trying to do was say, okay, what's the difference in cancer incidence between these different counties? Because the people were eating different food. But the key thing is that they're a relatively genetically homogenous population, and they usually stayed near their home villages their whole life. So they weren't like moving around all over the place. A very good study population. And what they found was there was a huge difference in cancer incidence between the different populations. But what I think is also very interesting is at the same time, American cancer rates at that time were 5 times higher than the Chinese anyway. So our American diet is about 15 to 16% protein for most people that are eating a standard American diet, and about 80% of that protein is coming from animal products. The Chinese diet was only about 9 to 10% of calories were from protein, and only about 10% of that was from animal products. And you can see a huge difference in cancer rates based on what type of protein and how much protein is being eaten in a population. So I would definitely recommend that as a one to look at. Now let's talk about diabetes. I love this study. I ran into this study at one point. This is what really made me think we are approaching diabetes completely incorrectly in our society, because they took 20 participants with type 2 diabetes, and they did put them on like a metabolic ward. This was an inpatient sort of study. But what they did, these diabetics were already on insulin therapy, and they'd been on insulin therapy for years. And what they did is they fed them a high carbohydrate, high fiber diet. So whole food, plant-based. But at least when I was in medical school, they said, you don't feed diabetics carbs, right? Like that'll mess with their blood sugar. Now we know that it really depends on the type of carbs. So these were all complex carbohydrates, whole plant foods, and they forced them to eat so much food that they maintain their weight. Because we always know that if you lose weight as a diabetic, usually your blood sugars will get better. But in this case, they forced the patients to keep eating. Every day they weighed them, and if they lost weight, they made them eat more kale and like more potatoes. And so over that period of time, and the goal was to say, is it the food or is it the change in weight that makes a difference when you change your diet and diabetes? And what they found is after just 16 days, 11 people were completely off insulin. I mean, it's like a little over 2 weeks. You spend years giving people insulin, and we all know as physicians, usually every year you're giving them a little bit more. You know, getting a little worse, they're gaining more weight. 16 days, and everybody's insulin requirements decreased, and their cholesterol also dropped about an average of 80 points. 2 weeks. That's almost like going on a holiday. Perhaps we could have these types of holidays, but I don't know if we don't want to go hang out in the hospital for 16 days. But we can reverse diabetes with diet. We've known this. This is the thing, though, that is very discontenting to me. We've known this since 1979. The study was done in 1979. I was 8 years old. We've known this almost my entire life, and how is our diabetes rate right now? Look at this. Up like that. So, there's some other disruptors out there, like Neil Garner, and he's done some fabulous research that's really randomized controlled studies on vegan diets or plant-based diets and what that can do with diabetes. So he has tons of studies, but I'm only going to talk about this one, and I would highly recommend anybody who's interested to start looking into his research and his books. And this is where he compared a plant-based diet or vegan diet with the American Diabetes Association recommended diet. And he took these 99 people who were living in the community. So this is not in the hospital, this is out in the community. And he randomized them to either a whole food plant-based diet or to a American Association of Diabetes diet. And then he said, okay, how did things go? Everybody got better on both, with weight loss and with hemoglobin A1C, cholesterol, but the people on the plant-based diet did better. They lost more weight, their A1C dropped down more, their cholesterol and their LDL dropped down more, and you can see this is the graph of the hemoglobin A1C between, this is the ADA diet, and this is the plant-based diet. Now, at least they got better on the ADA diet too, right? Because they got rid of some of the junk and everything, but it didn't go far enough to get the results that you get on a plant-based diet. And here's another one of my favorite innovative disruptors, and he is going to be speaking with us later on today, Dr. Hans Deal. He started the Complete Health Improvement Program, which is a out in the community lifestyle intensive therapy change that has to do with seeing patients for about 40 hours of education over a period of time to help them change their lives. He has had over 85,000 participants go through this program. He's had over 45 scientific publications about it, so this is evidence-based, and that's the key. A lot of times when we hear about lifestyle medicine and everything, like, oh, that's a little goofy. You know, we like procedures in medicine, we like medications in medicine, but this stuff has been tested. So I encourage everybody to go out and check out the research. This has to do with return on investment. That's the one I really wanted you guys to know. So there's a ton of studies out there about CHIP, but this one had to do with Vanderbilt University. They took their employees. They said, okay, we're going to take some of our diabetics, put them through the CHIP program on site at the employee to make it as convenient as possible. Ended up being 28 employees. So this was voluntarily enrolled. It wasn't randomized. But they found amazing things for this. They found that almost 62% decreased their A1C. They found that almost a quarter were able to get off at least one medication. They had a greater than 30% decrease in the participant medical costs year over year. 30%. I mean, that's pretty good. And the return on investment was 1.38 to 1 in just 6 months. So these programs, done appropriately with the right therapeutic dose, can pay for themselves because you see patients getting healthier. Less medication, less ER visits. It's just something that we haven't looked at as much in our society as a true therapeutic intervention. We often think of prevention, but this can treat and reverse disease as well. So, how are we doing as far as our lifestyle habits? I think this is a great study. It's Ford et al. Who studied over 23,000 people, and they said, okay, just looking at 4 lifestyle factors. Is your BMI less than 30? So that means, are you not obese? I mean, you can be overweight, but is your BMI less than 30? So you're not obese. Do you smoke? Are you active 3.5 hours a week? So that's like 30 minutes a day, just getting up and moving around. Doesn't mean you have to be a triathlete, just means you gotta be moving your body. And higher intake of fruits, vegetables, whole grains, decreased red meat. So it doesn't mean that they were vegan, just meant they were focusing on shifting towards more plants. And he found that if you follow all 4 of these healthy lifestyle factors, you have a 78% decreased risk of getting any chronic disease, heart disease, cancer, diabetes, decreased by 80% compared to the people that didn't have any of those lifestyle factors. I mean, if this was a pill, would we not all want to be audited? Decreasing your risk 80% of developing these types of diseases? If this was a procedure, I bet most of us would sign up to have it done. But this is lifestyle. Is there changes that we can all make and we can help our patients make way more effective than any pill or procedure that we have out there? So knowing that, how are we doing in America with all of this? This is an American study. This is NHANES data. And we found that we were looking to see a little bit different criteria, but pretty much the same. Do people have a sufficient physical activity? So they were actually measuring it by accelerometer. So how much activity are you getting every week? Are you eating a healthy diet? Fruits, vegetables, nuts, seeds, whole grains. Are you a non-smoker? And do you have a recommended body fat percentage? So that was kind of their BMI stand-in sort of thing. They found that only 2.7% of Americans can say, yes, I've got all 4 of those lifestyle factors. 2.7%. As a doctor, this makes me go like that. How is it possible that we know, we have studies, we know that we can be making such a huge difference, that these things can save lives and extend vitality and longevity, and that only like less than 3% of us are availing ourselves of that opportunity. So that brings me to the concept of therapeutic dose, because these changes are not complex. It's not complicated. You don't need to be like a physicist, but they're not easy. they're not easy in our society because we are not set up to have the healthy choice be the easy choice. Really, we are set up to be getting ourselves sick because the convenient choice is usually the least healthy choice that we have available. And so a lot of people, doctors, administrators, insurance people, they're like, yes, we know these lifestyle changes are good and it would make everybody better, but no people do it. Well, I would say, think about it from a really clinical doctor perspective. You come into the ER and you're in florid congestive heart failure, okay? So you come and see me and I say, oh, you're in heart failure, you're dyspneic, you can't breathe. I'm going to give you 10 milligrams of Lasix by mouth. Are they going to get better? No. But is that because Lasix doesn't work for heart failure? No. Lasix is good for heart failure, but you have to give enough of it and you have to give it in the correct way, the appropriate dose and the correct route. Same thing with lifestyle change. If you give somebody just a handout and say, okay, I know you have diabetes and obesity and your joints hurt and everything, you need to exercise more, here's some information about food, that's like giving them the 10 milligrams of Lasix. It's not enough. They need more. So some people, they can watch a movie and they turn their, Forks Over Knives or something, they turn themselves around. Some people, they just need a book. Some people need an ongoing, 4-week program or something. And some people need, like the SHIP program or the Orange program or shared medical appointments, they need to spend some time with clinicians and people not really holding their hands, but like supporting them to make these changes. And then they feel so much better that it's kind of self-sustaining because they don't want to go back to where they were before, but they need your time. Dr. Esselstyn says, the only way that I know to get people to change is to show them respect. And the only way I know how to show them respect is to give them my time. And I feel like as clinicians, that's what we need to do to make those differences for our patients. So as we wrap everything up here, when we talk about whole food plant-based diets, this is kind of what I feel like the society perception is, right? And everybody's like, I don't want to be that guy. That is not who I want to be. But I gotta tell you, this is what the reality is. Alright? These are vegan bodybuilders, right? And Patrick Baboumian, who is the strongest man in the world, he has literally carried gotten the prize, he's plant-based. And so he's often asked, how can you be as strong as an ox without eating meat? And he comes back and says, have you ever seen an ox eating meat? So we do not need to eat the meat for the protein. And actually, our Dr. Kathy Parmley will be talking about plant-based athletes later today. Plants actually help our performance. So there's a lot of things going on here in the Lehigh Valley with local lifestyle medicine. Dr. Bonnie Coyle is going to be speaking about that later today with St. Luke's. These are just a couple of things to whet your appetite. There's the Eat Real Food Mobile Market and the Lehigh Valley Corner Store Initiative. That's getting produce into the areas of food insecurity that need it. Because when you think about it, if we're trying to get people to eat all this healthy food and they can't get to it, that is relatively counterproductive. So how do we get that out there? Kellyn Schools has to do with teaching 3rd, 4th, and 5th graders healthy lifestyle choices. And Kellyn Kitchens has to do with actually teaching people how to cook, like the type of food that you're eating today. Whole food, plant-based, inexpensive, not taking like your whole week to cook it. And we're planning to start CHIP program cohorts with the East Area School District, the Bethlehem Area School District, and St. Luke's Employee Health. So we'll be able to bring some of that therapeutic dosing kind of into our area. And there are 2 new lifestyle medicine-focused residencies, a family medicine and an internal medicine one, starting up at St. Louis Anderson campus that we're so excited about. Because I know some people have, yeah, go ahead, clap for that. I mean, that is awesome. Dr. Coyle will be talking about more of those initiatives, but what happens so often when I go speak places, people come up and they'll be like, I want to have a doctor like this. Where can I find a doctor like this? And that's what we're trying to create here in the Lehigh Valley, is a whole plethora of doctors like this. So as we end up here, I often think about my medical career, my trajectory, all the way from Penn Med to now, and I am a little discontented about where I was and how the pace of change. But I think this is a good way to look at it, which is do the best you can until you know better. And then when you know better, do better. And that's what I want for all of you guys today, is as you look into the literature, as you hear all these speakers, you may find some things that you're like, ugh, that makes me a little uncomfortable, or I wish I had done things differently. But think about how we can all work together to do better in the future. And this is a really important concept to think about. And it's really, what type of healthcare provider do you want to be? Do you want to be the type of healthcare provider that spends all your life mopping up the floor, mopping up the mess, and maybe you get new mops, maybe you get mop extenders that can help you out, maybe you get people that can give you electronic mops, I don't know, but like you're just like mopping all the time, trying to clean up the mess. And that's valuable, like the mess is there, we got to clean it up. But in order to change the trajectory, you got to turn off the faucet. And so are you going to be a faucet turner-offer type of clinician? Or are you going to be just mopping up the floor, which is good, but is not enough? And so I have a couple of resources up here. You guys can take quick pictures if you want to. But we are about to start rocking and rolling through our Lifestyle Medicine Conference. And so thank you all very much for coming.